For what purpose, the gentleman from California?
Mr. Speaker, I yield myself such time as I might consume.
Without objection.
I rise in support of the motion to suspend the rules, and I urge my colleagues to support the bill. The bill has passed the Senate, was reported by the Commerce Committee unanimously, and it should be acted expeditiously on in the House. The Ryan White program was originally enacted in 1990 to respond to the crisis in AIDS health services in America's cities and states and in its clinics and hospitals. This act has been a great success. Outpatient services are now available as an alternative to expensive hospital care. Prescription drugs are provided to people who have no other source of coverage. Early intervention treatments can be given to keep people healthy longer. And effective service programs for mothers and children are up and running. Programs which also coordinate their activities with research organizations to assure that appropriate research opportunities are available to their clients. This law has improved the health care for people with AIDS and HIV all over the country. This bill renews the authorization for these successful programs and fine-tunes the response to the new and changing needs of the epidemic. I'm especially pleased to say that this legislation and the committee report that accompanies it emphasize those basic services that people with HIV need most, the services that slow the progress of the disease, that prevent opportunistic infections, and that meet basic primary care needs. And it targets assistance to those people least likely to be able to afford such services themselves. At a time when funding will continue to be limited, it is important that all service programs focus on the primary care of people with HIV. This legislation does contain some controversial items. The inevitable disputes over formulas among cities and states appear here, as they have done and will continue to do so in much legislation before this Congress. The formulas contained in this bill represent a good faith effort to provide basic care to all Americans with HIV, and this bill is a balanced political compromise. In addition, this legislation contains compromise provisions regarding the testing of newborns that I have worked out with the gentleman from Oklahoma, Mr. Coburn. Although the so-called Coburn-Waxman amendment bears my name, I do have many reservations about this provision, as I am sure does the gentleman from Oklahoma. It deals with an issue about which there are profound differences in approach, which cannot be smoothed over. However, I believe the compromise approach embodied in this bill is necessary to move the Ryan White reauthorization forward, and I urge members to support it today. Let me be clear at the outset. We do not disagree about the ultimate goals here. Mr. Coburn and I both want to reduce the number of HIV infections passed from mother to infant, and we have agreed that the most effective means of achieving that goal is counseling and voluntary testing of pregnant women. This agreement is reflected in the findings of the Coburn-Waxman provisions. Mr. Coburn and I also agree that we want to reduce the rate of preventable pneumonia and other illnesses among HIV-infected infants and to improve their health care. Where we have differences is the most effective way of achieving that goal. During the committee's consideration of this bill, an amendment was offered by Mr. Coburn that would have required all states to initiate the mandatory testing of all newborns immediately. I opposed that amendment, as did a wide variety of health and medical groups. I asked the gentleman from Oklahoma to withdraw his amendment and to work with us to produce an amendment that would provide alternatives to the mandatory approach. I am gratified to say that he was willing to do so and that our staffs have worked since that time to come to some agreement. The provisions reflected in this bill are the product of that work. This provision is not perfect by any means. As I say, I have serious concerns about its possible effects. I believe that voluntary programs of HIV testing of infants would result in more infants receiving the care needed to prevent pneumonia and improve their health. I believe that mothers who are highly encouraged to have their babies tested will be better partners in the lifelong medical care of these children than will mothers who are required to do so. And I remain very concerned that the emphasis on newborn testing will divert attention and resources from the more important goals of encouraging pregnant women to be tested themselves in time to provide care that will reduce the chance that the baby will be infected. But I believe that the Coburn-Waxman amendment is a significant improvement over other proposals that have been considered. This provision postpones requirements that a state mandatorily test all newborns until a time when it is agreed such mandatory testing is the recommended standard of medical care. Some believe that day will inevitably come, but at this time, virtually all medical groups oppose the practice. The provision also gives states 2 years to develop effective alternatives to mandatory testing. If after that time mandatory testing is determined to be the routine of practice, and if the state is not reaching most of its infants, the state will have up to 18 months to enact a mandatory testing law. I support the Coburn-Waxman amendment as far preferable to the alternative of an immediately effective requirement of mandatory testing. I thank the gentleman from Oklahoma for his willingness to work with me on this more flexible approach. I also want to take this moment to remind my colleagues why this action is taking place. Over the past year, new research developments have made it possible to prevent pneumonia and other diseases in newborns. That is why the question of testing babies is being debated and legislated about. In addition, there have been research breakthroughs that are true good news about the possibility of reducing HIV transmission from mother to child. That is what the findings of this bill are about, stating that voluntary prenatal testing should be the standard of care. This is not about testing newborns, but it has often been discussed in the same breath. But both of these possibilities, preventing HIV through prenatal services and preventing disease in infected newborns through early intervention services, require services. Testing is not the answer. Medical care is. Testing without care will make no difference. Testing without treatment is a cruel hoax on everyone concerned. And in truth, most of the care for HIV-infected pregnant women and children come from one source, Medicaid. I hope that as my colleagues move to reshape the Medicaid program, that they will remember that there are services that we can all agree should be available to poor people. Many of my colleagues from both sides of the aisle support the Coburn-Waxman amendment that may require states to provide testing of newborns if it is determined to be the medical standard of care. I hope that their enthusiasm for testing will be reflected in equal enthusiasm for assuring that the health care services are paid for. Finally, the Coburn-Waxman amendment includes provisions about health insurance. These provisions repeat the protections that the Americans for Disabilities Act provides for people with any disability in any employment setting. It was believed to be appropriate to repeat these protections here so that anyone concerned that HIV testing would be used inappropriately would see the testing provision and the protection in one place. In addition, the provision describes how insurers may respond if fraud was committed. It is my clear understanding that this provision does not override any ADA, state law, or NAIC provisions that limit what may be asked of a person seeking insurance or holding insurance. These provisions are included to provide clear consumer protection and to allow insurers to respond appropriately if there is fraud in the answering of permissible questions. For instance, the National Association of Insurance Commissioners and many states have regulations restricting what can be asked of a person who is insured or seeking insurance. The insurance provisions of this amendment provide additional protection for these consumers and are not intended to undo the NAIC and state actions. In conclusion, I would note for my colleagues that this bill was reported from the Commerce Committee unanimously. Whatever the differences among us on other issues, we have come together to reauthorize the program of AIDS health care services and to assure those who depend on it will continue. I urge my colleagues to do so today. Finally, I would like to thank the staff involved for their diligent work on this important bill. Karen Nelson, Kay Holcomb, Melanie Harned, Mark Agrist, Roland Foster, and Peter Goodlow have put in many long hours on this legislation, and I want to express my appreciation to them. I would note from my colleagues that this bill is before the House with a unanimous recommendation by the committee, and I would urge that all members support it. I reserve the balance of my time, and I ask unanimous consent to revise and extend my remarks.